I am Dr. Rajasekhar M R from Chirag Global Hospitals, JP Nagar 2nd Phase, Bangalore. I am a practicing proctologist and colorectal surgeon for the past 25 years, and I am also a general surgeon for the past 35 years. Acid reflux or GERD, both are one and the same. GERD is nothing but gastroesophageal reflux disease. So, though the name looks too big and scary, don't worry about it. What it means is, see, there is acid production in the stomach for everyone. Acid is required for our digestive process. So, everybody will have some amount of acid produced when we eat food, and that is required for different reasons. And if the acid production is more, yes, it can come back to the esophagus or the food pipe, causing burning sensation inside our chest. So that is called acid reflux. It is not reflex, reflux means coming back. So going up from the stomach, it comes into the esophagus, causing burning sensation there. So that is the beginning stages. Or where the esophagus joins the stomach, it's called Esophageal Cardiac Junction, where it joins the stomach. So that junction, there are no sphincters or mechanism where it will close and open. There are no muscles there. So there is a physical angle and all that which will prevent that. So sometimes that will not be working properly and acid comes back, especially when you lie down in the night, when the stomach is empty and if the acid is there in the stomach, when you lie down, it will just pass back and causes a lot of irritation there. So mild reflux causing a little burning sensation is common in people who have this peptic ulcer or increased acid production in the stomach. That's common. But if it causes damage to the esophagus, even up to the throat, some of them it can even go to the lungs, that acid, and cause chronic cough and all that. So when it comes, that reflux happens and causes damage, causing ulcers, even causing bleeding, causing narrowing of that area, pulling up of the stomach into the, all that can be caused at later stages. So GERD is a serious disease, but most of it is caused by the acid coming back. So medically, when we treat, we give the medicines which will reduce the acid production. Whereas if it is too late and already damage has taken place to the esophagus, and if it has become too lax and all, where it has to be prevented physically, we do surgeries to prevent the stomach from the acid coming back into the esophagus. And its relationship to colon cancer is very far-fetched and very difficult to explain. Normally, it should not happen. Colon is the large intestine, cancer is a different disease, this is a different disease. Sometimes some statistical incidences, coincidences can happen. So, but in general, this is a different sort of disease occurring in a different organ, and cancer in the colon is a different disease. So, normally we don't like to correlate that and get scared, but GERD itself is a significant disease and has to be treated medically in the initial phases vigorously and properly. If I want to give a special message for prevention or treatment of GERD, GERD is nothing but a little overproduction of acid which is coming back into the food pipe or esophagus. So it is more or less a lifestyle disease. Obesity is one of the causes. Too much of anxiety producing more acid production is the other cause. And then eating lot of spicy food, junk food, outside food and all again can cause that increased acidity and reflux. So these are the things which are preventable diseases. So we have to take care to prevent these by not having very big abdomen and a big tummy. So have good exercises and then reduce your unnecessary junk food and spicy, oily food, and lead a better lifestyle rather than taking medicines and this one, because how long one can take medicines for GERD? As long as you are taking medicines, it is fine, again and again it will be happening. So it is more important to have lifestyle changes in the form of proper diet and in the form of good exercises and fitness, and avoid smoking, if possible avoid alcohol or at least reduce it. These are all the things which are leading to more of GERD nowadays. It is a self-acquired, self-invited disease, so it is in our hands to prevent it.